Hello friends, I'm Dr. Jivram. I will discuss the treatment of hiccups. General measures to treat hiccups. Home remedies or ways to get rid of hiccups include holding your breath, have someone frighten you, drinking a glass of water quickly, pulling hard on your tongue, beating a lemon, gargling with water, using smelling salts. Hiccups can be prevented by avoiding overeating, eating too quickly, or drinking too much to help prevent hiccups. Treatment of severe hiccups. Emergency. First choice, injection chlorpromazine IV. The use of chlorpromazine 25 to 50 mg administered intravenously, with a second dose within 2 to 4 hours intravenously or intramuscularly, followed by oral. Tablet chlorpromazine 250 to 500 mg BD or tablet metoclopramide 10 mg 4 times daily orally, or tablet baclofen 5 to 20 mg 3 times daily orally, or tablet midazolam 10 to 60 mg 24 hours by CSCI, or tablet or injection haloperidol 5 to 10 mg per oral or IV. Treatment of hiccups on the basis of cause. Pharyngeal stimulation, nebulize 0.9% 2 ml for 5 minutes. For gastric distension, peppermint water. Peppermint water facilitates belching by relaxing the lower esophageal sphincter. Peppermint water may have to be extemporaneously prepared for the patient. It may be difficult for patient to source in the community. Or antiflatulent, simethicone 25 mg twice daily, or prokinetic tablet metoclopramide 10 mg tightens the lower esophageal sphincter and hastens gastric emptying. Peppermint water and metoclopramide should not be used concurrently. Gastroesophageal reflux, prokinetic metoclopramide 10 mg 4 times per oral daily. H2 receptor antagonist or proton pump inhibitor, capsule omeprazole 20 to 40 mg twice daily before meal, or capsule esomeprazole 20 to 40 mg twice daily about half hour before meal. Diaphragmatic irritation or other cause, tablet baclofen 5 to 20 mg 3 times daily orally, or tablet nifedipine 10 to 20 mg 3 times daily orally. Tablet haloperidol 1.5 to 3 mg at night orally, or tablet sodium valproate M for 15 mg per kg per 24 hour in divided doses, or tablet midazolam 10 to 60 mg per 24 hour if all else fails.